I was thinking we could start off just asking you what you know about osteopathy, just so we can figure out where you're at, and then we can go ahead and add to your knowledge. So, anyone want to let us know
what is osteopathy? Can anybody answer that question?
Yes.
It's a holistic approach to the medicine career. You try to treat the overall human body as opposed to just like pointing out a particular symptom and giving a medicine to it. But what I've heard in the end, like after like all the training, like when you go into a hospital, you follow the same protocols as doctors.
As far as going to the hospital goes, we are peers with MDs. But the difference between osteopathy and allopathic is what you mentioned. It's like you have different tools in your bag. MDs and osteopaths get the same amount of tools. We get the same amount of education, get the exact same stuff that the allopaths get, except we get an extra tool bag. A lot of what we do is stuff that we use with our hands. We use a lot of diagnostics through our hands. Because the thing is, like, for us to be able to understand what's going on with the individual, yeah, we have stethoscopes, we have otoscopes, you have all those instrumentation. But what we really need to get in tune with is trying to actually listen to the body. And what we do with that is we actually use our hands to get a sense of what's going on, not only with just our stethoscopes and our otoscopes and all the equipment that we have, but there's an added dimension to it. There's the palpable side of things. And it's being able to see, okay, yeah, here's the general scheme of things, but what else is going on with the body? And our philosophy is different going into the medical world. Again, we get the same tools, but our belief is that the body is the unit and that there is an inherent healing mechanism to it. So not only are we going to try to treat the symptoms that you see in a patient, but we're also going to try to maintain their health. And that's our goal. As osteopaths, that's what we try to do, is we try to not only treat the symptoms, but how are we going to make it so that we continually get you to a healthy state. And I guess a lot of that is just the philosophy, the way we approach things. To understand that, because throughout our years, we're always ingrained with the body's a unit. The body has a self-healing mechanism. And here's all the information that you have. Now what can you do to get into the ultimate healing state, or the ultimate body state? And that's kind of the mentality that we have. So we are going to be in the same level with the MDs, but I guess we approach it a little bit differently as far as philosophy goes. So it's a little bit how osteopathic medicine.
And Jay, you did a great job explaining that. One thing that I would add is that at the end you said that in the hospital you basically do the same thing, and to some extent a lot of DOs just practice things that are similar to allopathic medicine, but a lot of doctors go in the hospital and clinics and do a lot of OMT, which is one of the big parts of our training, which is what Jonathan said, is to use our hands to diagnose and manipulate the body to bring it to its ultimate healing potential. And a lot of what we do isn't healing someone, but it's more of using their body to heal themselves and just promoting that optimal healing mechanism. So, we actually have doctors at our school that go every week at hospitals, and they do OMT in the hospitals. We have a clinic in Vallejo, and their doctors just do only OMT. So, it's not that you can't practice OMT, it's just if you want to do it, you can do it.